Good morning, Dr. Badia here with another bi-weekly episode of Fixing Healthcare from the Trenches. As you can perhaps imagine from the music, we are actually in Europe. We are in Switzerland, in the outskirts of Geneva, and our guest today is Dr. Philippe Cuénod, a very, very good friend and colleague of mine. We've known each other for almost 30 years. And tomorrow, both of us will be driving to Val d'Isère, a resort in the French Alps, where we'll be participating in a meeting about wide-awake surgery and some advances. Dr. Cuénod studied medicine at the University of Lausanne. He did his general surgery training in Fribourg, and then hand surgery in Geneva, and then in a very special place, which is where I met Philippe almost 30 years ago in Bern. So Philippe, come join us. I love what you're playing.
Because we have drank too much tonight. Yeah,
we had a dinner with. I spent most of the day with Philippe's colleagues. Where we did some surgery. That was a terrific wrist case, an open wrist surgery we did at his clinic, which is called Clinique de la Main, Geneva. And this was started after you had Dr. Andre Chamet retired some years ago. And you guys had that clinic very nearby, and your 5 partners now. Dr. Cuénod's also on a board of examiners for the FESH, which is the Federation of European Societies for Surgery of the Hand, very prestigious organization that basically trains and continuing education for hand surgery. So I asked Dr. Cuénod to join me because I am here in Switzerland, but because there's a lot of parallels with the struggles of the U.S. healthcare system. And I should say off the bat that I believe Switzerland is number 2 on the list, the bad boy list of healthcare systems, spending, I think, somewhere around 10% of its GDP, gross domestic product, on healthcare, whereas the United States, believe it or not, is at 20%, 1 out of every $5. And if you notice, we're in this, which you guys must be laughing at, what's happening with our election system. If you've noticed and you followed the news, there has been zero discussion about healthcare, and it's sucking up 20% of our economy.
Yeah, it's amazing because we talk a lot about it in Switzerland. This is the main concern of people in the street.
It's a big concern with people in the U.S. as well, but the media has just ignored it. And yes, we have problems with immigration. The economy's gotten much better lately in the U.S. So some things are working, but certainly healthcare is an issue. So anyway, I met Dr. Cuénod in Bern. He was training with Uli Buchler, and I went and spent a week there. We had a wonderful week where we had fondue and we did canyoning in that was kind of the department outing.
I hope you learned some surgery too.
I know, a little bit, but most importantly, we became friends and we've kept in touch. So, so tell me, there are some very basic problems with the Swiss system, as there is with the American system, and in fact, your colleague Stefano Lucchino from Lugano and Locarno, Switzerland, is a contributor in the book of Healthcare from the Trenches that I wrote during the pandemic. And he has told me a lot about these issues. And what I wanted to understand is what is the overarching problem, would you say, with the Swiss system? And then I'm going to ask you for 3 potential solutions.
So the system, we before 86, we had no special system with some people had insurance, were covered for the treatments, and some others had no insurance, they paid by themselves. And in 86, the people, that in Switzerland we decide, the people decide everything, most of the time. And we decided to have a basic insurance for everybody. That means that everybody is covered for the basic, for all the operations, except special things that require some discussion. And there is another system that are the private insurance. That is the if you can afford, you have a extra insurance that allow you to go to the clinic and to have special treatment. I mean, it's the same treatment, but it's different conditions.
And everyone pays into the system, the national system, through taxes.
No, with it's per capita. I mean, you receive every month your bill to pay your premium. That
for the national system.
It's not a national system. It's and nobody knows how the level of the amount of the premium is calculated.
Okay.
And there is we have to say that nobody understands exactly how they fix the prices. A few years ago, it has been proven that the insurance company had charged too much money in some places because they thought that they required more money. And this has been a big issue in Switzerland, and it has been so the company has to refund 50%. 50%. This is not bad, but of what they have overcharged. Right. But actually, every year we wait for October and the announcement of the government, the raise, not the price, but the raise of the premiums. Because every year they raise by 5, 10, 12, and nobody knows because it's not exactly. It doesn't reflect the increase of the health cost. And it's
certainly I'm going to assume, and like similar to U.S. in fact, we're the opposite. Each year we keep getting paid a little bit less despite inflation.
Yeah.
So I assume that you're charging people more for premiums, but you're not being paid more, are you?
No, not at all. I mean, in the contrary, in 2018, the Conseil Fédéral, with the government, the executive, decided, and it's against the constitution, but they did it. They decided of a new tarification, and the Minister of Health said, I've decided. He decided nothing because he had no qualification to do it, and he gave us a new tarification that was 40% lower than before. And 40%, and they are preparing for 2025 a new deal, if I dare say. That is not a very good deal for the doctors, but for the insurance, probably good. And
so you've got these problems. What would you say are 3 initiatives that you would like to see that could make a major change?
So I think that first of all, we should have only one basic insurance. We have I don't know how many insurance companies that all have a basic insurance, and actually there are huge differences between basic premiums. Some people will pay 300 francs a month, and others 500, and there is no real reason for that. So I think that there should be one basic insurance for everybody, as it is compulsory to have an insurance, basic insurance, with a control of the state, not a tight control, because if there is too much control, it has not to be a state insurance, because I'm not sure, it would probably cost more. But
so this would be, so basically it would be sort of a private.
Yeah, we have.
So who would get that contract?
But we have a system for the accident. We have a company that is called the Suva.
For all
Germany.
accidents in Switzerland.
For a lot of accidents, above all in construction and all these jobs. And actually, it works very well. Sometimes it's a bit boring because we have to discuss, but it works, and it's non-governmental, but it's a bit anyway. There is a control, but it works. And
so your solutions would be one basic insurance. Okay.
And if people want to have a private insurance, they do it by themselves.
So number two, then.
Second,
separate.
If there is not basic universal basic insurance companies should not be allowed to have at the same time the basic insurance and the private insurance, because we have the feeling that as they are not-profit organization according to the law, and we have no control of this, they probably, I have no proof of that, but most of people believe that all the costs are put on the basic insurance, and they make the profit with the private insurance, which seems quite
right. So if they can have both, then they could manipulate, and insurance companies never manipulate.
I mean, the doctors are also. Clinics, doctors, everybody has a part of the responsibility, but
because it's become a game. You have to play the game, unfortunately.
But as I told you before, the surgeon who makes a lot of money in Switzerland doesn't make a lot of money with the basic insurance. I mean, I would know it because you've seen how much I work, and I would be a very rich man, but I'm not. So that means that
you have a nice piano.
But I don't play well. You drink too much. And the problem is that the one that make a lot of money are making it with private insurance, and the fees are not the same.
That's similar to so many systems around the world now. So it's an interesting idea. At least you're saying that the insurance company can't play in both sandboxes at the same time.
And I think that the third point would be that people follow the rules. I mean, if the insurance company are really non-profit organization, if they open their books every year and they are supposed to do, and they never did, if the doctors are doing correctly the job and they don't overcharge when it's the problem is we have a system of tariffication that is based on time. That means that the one who is completely dumb and doesn't know how to, he has no idea, it will earn more than the good one.
So it penalizes efficient or very good clinicians.
You shake hands with the patient, you know that he's a Dupuytren's Dupuytren's contraction. Right. He has to be operated on. It takes 5 minutes, 5 seconds.
Just your expertise and your experience, and that's not valued, which is a problem in the U.S. with our primary care physicians, because they have a lot of knowledge, and yet they're not doing procedures. So they're paid based on it's more coding. It's related to time, but it's not very fair.
But there is also one point. We are complaining. Insurance company complain that people go directly to the specialist. The problem is they say, first of all, there must be a gate controlled by the generalist. Okay, let's put it like that. Yeah. So you see a patient coming after 6 weeks of treatment by a general practitioner who have investigated with an MRI. With the MRI is you don't even take an X-ray. You just make an MRI just in case.
Yeah, we get the same problem. Yeah.
And the lady comes with the bag, the bag.
Bag of studies. So Well, actually that's going to allude. So I'm going to jump into my 3 points.
Yeah.
Okay. So because one of them is relevant to what you said. So first of all, very consistent what you're saying is that in our system we need authorization or approval for every step of the way, which actually drives up the cost, right?
Mm-hmm.
So what I always say is we should have oversight, not authorization. So there's oversight. You need oversight, right? You said there's bad players, there's physicians maybe who aren't always doing the right thing and most ethical thing.
But some are very good.
I think most are very good. I think we trained a long time. We took an oath. I think most physicians really want to do the right thing and are not overcharging. But we do need oversight in any field. Going to the last point you just made, I think seeing the right clinician or the right specialist, the right clinician at the right time saves a lot of money.
Sure.
In our system, and I know it happens here, patients spend weeks getting treatment, which the person who's actually focused on that pathology, that problem, knows immediately what needs to be done and what tests do not need to be ordered.
I mean, if you're out of breath and you have a pain in the chest, you're not going to see a general practitioner. You see a cardiologist
or a hand surgeon.
And surgeon, yeah.
Right.
Yeah.
So
I will lend you one of my stents. Yeah.
Yes.
But
that saves money. That saves money, right? Seeing that person early on. The third point is what we're doing right here, Philippe, is public education. Until the public understands what the problems are with both our healthcare systems, it's going to be very difficult to fix it. So the more we can educate about what those problems are, whether it be this and many other podcasts, my book and many other books, the question is, the popular media needs to take an interest in this topic.
It's very difficult because as long as patients believe that the bill they receive is what the doctor earns, it will never change. Yeah. I mean, you have seen the clinic this afternoon. It's a big thing.
Very impressive.
Of course, it costs a lot of money. Yeah. And this money is brought to the company by our work. And we are 6 surgeons. We are created 90% of the rough income. So it has been we pay all the costs with this. And it doesn't mean that we earn the costs. We earn what remains after we have paid everything. Yeah. And of course, if you're a general practitioner, you make a much lower rough income, but you earn a very good life. I mean, there is no, but we have to put everything in perspective, and it's very difficult to make people understand.
Yeah. Well, that's why we're here, right? Little by little, the people, question is getting people to take interest. There's many other social issues that have come up in the last few years, right? That are all over social media and the popular media. And hopefully there'll be an interest in this because, at least in my country, it is not sustainable. I think you're in Switzerland, you're feeling the crunch. So hopefully people will digest some of this information and please share it. Okay. Liking us and, we want to hear comments, feedback, but definitely share this and get dialogue going with your own friends and family, because we need to fix our healthcare systems. These are basic everywhere.
It's amazing. So you see that the system doesn't work anymore. And I think that there are solutions, that very simple solution, when there is no discussion. The problem is about the fees. If you make a standard consultation is first consultation. If you make consultation,
but there's only one problem with that. And the problem is this: is that not everybody is as good as a Dr. Cuénod.
Yeah, sure.
No, so what I'm saying is we're the only.
Of course not.
We are the only profession, right? I mean,
Yeah.
when I right now I'm engaging attorneys in several. I mean, it's just a necessary part of Western civilization. Is and the attorneys charge differently based upon their reputation, experience, and that's a decision you make whether you engage them or not. It doesn't work that way. In healthcare, the worst trained or the person who doesn't go to conferences like both you and I are going to at our expense. We're taking time away from our practice.
And it's not
to go.
paid by the. It's not
No, of
paid
course
by,
not.
as people.
And we decide.
People, the other day, a patient told me, "Oh, all your congress is paid by the people who I paid them."
That's a misconception. But the point being is that's why I take issue with whether there should be flat fees. That is a very difficult question, and that's why I said the first thing I said in my book is I do not have the solution to fixing healthcare, but until we get a dialogue in the public, that's the only time that we'll get people thinking, and we'll fix it. So until next episode, thank you everyone. Join us back in 2 weeks for another episode of Fixing Healthcare from the Trenches. And again, keep the dialogue going, and let's care about this very important issue. Until then, thank you.
Thank you for
joining me.
Thank you for asking me to join you.